Welcome back to Talk Rehab to Me podcast, where we explore all things rehab. I am Daniel Ampoma, your host, and I'm with Stacy Sharp, co-host. If you've ever wondered how hobbies, movement, outdoor adventure, and creative arts can be deliberate clinical tools for mental and physical health, I believe you are in the right place. Therapeutic recreational therapists don't just ask what hurts. They ask what makes you, the patient, feel alive. They build an evidence-based plan to get the patient back to doing what they love. So whether you are a healthcare professional, someone in recovery, or just curious about how intentional play can rewrite neuroplasticity and build real-world resilience. So today we are bringing you expert insights, client stories, and also practical strategies from our guest for today's session. We have Ted Denning and Maria Bruce. So please pause your busy day and let's get ready to play with purpose.
Talk a little bit, Dr. Ampoma, but I do want you to talk just a little bit about the types of patients that we treat here. I was just looking at our CMI, our case mix index, which has improved. Now, of course, we've always been higher than the national, but we went up from 2025 to 2026, 9.1%. So we are really working with a higher acuity, medical acuity of patients.
If you take a closer look at our case mix index, we take care of patients who have strokes. We take care of patients with traumatic brain injuries, TBI, spinal cord injuries. We also take care of patients who have neurological deficits. For example, we're talking about movement disorders such as Parkinson's. We take care of multiple sclerosis. We take care of myasthenia gravis. We take care of patients who also have disabilities. So think about that. We are across all the board. And not that only, we also take care of patients who have LVAD, left ventricular assistive devices. We're talking about patients who also have transplants. And in regards to the transplant, Stacey, think about it again. Heart transplant, kidney transplant, liver transplant, and lung transplant. You want to add some more to that?
We do a lot with amputations, and I think the most important thing to really pull into this group is when we think about acute rehab, we think of the normal therapy, right? You think physical therapy, occupational, speech therapy, right? Those are usually the ones that people are thinking about, those 3 hours of intensive therapy a day. Yeah. And not all acute rehabs are fortunate enough to have therapeutic recreational therapists, but we have 2 of them. And
yes.
And not only that, but we've had some award-winning items that have taken place. I'm going to let Ted, let's talk about the award. And I'm thinking about what was in, what is that newspaper, Washington Post? Yeah, what about that? The horticulture group?
So I am a recreational therapist here at Inova Mount Vernon Hospital, inpatient rehab. Stacy mentions our horticulture therapy program, which we're very proud of. We received an award from a local gardening organization for having a healing therapy, healing space, healing garden. We were recognized above other, locations around the area for this recognition.
And I'm so glad that you bring that up, because therapeutic rec is a lot more than just planting flowers, right? You all are specifically trained. So, Maria, tell me, when I see you, which usually I see Ted out in the garden planting, I think he likes it best. But when I see you all working with the patients, what specifically are you focusing on?
Sure. Well, like you said, I'm Maria Bruce. I'm another recreational therapist here at Mount Vernon. So the actual definition for therapeutic recreation from ATRA, that's the American Therapeutic Recreation Association, is it's a systemic process using recreation and activity-based interventions to address the assessed needs of people with illnesses or disabling conditions, serving as a means to promote physical and psychological health, recovery, and well-being. So, yes, of course, we bring patients out to the garden and they do love planting the flowers and watering, and all of that is good the same way it's good for all of us to be outside in the sunshine. But we're also working on very specific assessed goals that we have created for the patient. And those are very individualized. It's based on the patient's diagnosis. It's based on what they are working with in their PT, OT, and speech therapies. And it is also based on kind of what the patient's personal, what they find enriching and fulfilling in life and what's going to help them feel better.
So I'm hearing a lot of things right there. I'm hearing that we're collaborating with the other therapists and with nursing,
Yes.
and with the physicians, neuropsychologists.
Everybody, absolutely.
I'm also hearing that it's very individualized per patient.
Yes.
So it's not something that you take out of a book and say everybody's going to be doing this. And then
100%.
Exactly.
Yes.
Right. And then the whole, we focus so much with our patients at Inova on what matters most. And so, Ted, tell us about how you've dealt with a patient. You've figured out what matters most. Now, I know you've got some of these in the back of your mind because I see all the patients that come back to see the two of you years later to say, you know what, this is how you helped me. What would be a good example?
We recently had a young woman in her 30s. She was a very busy professional woman. She and her husband were running a business of their own when she developed symptoms of weakness, loss of feeling out of the blue. The diagnosis, we're going to call her K, just to protect her identity. Her diagnosis was Guillain-Barré syndrome, which is one of the neurological conditions that we do treat here in Nova Mount Vernon Rehab. And she really came in completely lost. Her whole world had been turned upside down. She didn't know what to expect. She didn't know what rehab was or what it was going to look like for her. She quickly became very active in our program and very involved, sometimes wanting to stay for extra time with us when her schedule and her energy levels allowed. She came away with, she was able to walk out the door. She was very excited. She cites recreational therapy as being a large component of her recovery and her time in rehab here. And she left a little blurb for me to read, to share. So Kay said to us, TR gave me something to look forward to every day. In practice, it looks like something small, showing up every day to work on a ceramic art piece. And it was the first thing that felt normal and fun since everything had happened. It wasn't tied to my physical progress goals, so it gave my mind somewhere to go besides recovery itself. It also put me in a room with other patients doing the same thing, and disconnecting from our own struggles. And that made me feel a lot less isolated. That hour always felt short, and I find myself wanting more time there. Going from not being able to move or do much for myself with GBS to having a tangible project to work on every day felt like I was accomplishing something. And the best part was being able to take home a piece of my journey. Every time I look at it, it reminds me of the people I connected with and everything I've overcome.
Wow. Powerful. Very powerful.
That is a very good summation from Ted. So to Maria, right?
Yeah.
So when someone is recovering from something like, let's say, a stroke,
Yes.
spinal cord injury, or maybe even joint replacement, how does recreational therapists like you, who's a professional in your role, help our patient population regain their independence? And at the end of the day, to get back to the activities they so love. What are your thoughts on that?
Well, like I said, we make individual goals for the patients. We take an inventory of what they were enjoying, before they came to the hospital, and also leisure interests that they may have an interest in exploring after they leave. We'll then set them up in various groups because we're a big believer in group therapy here, that peer support, that encouragement, that kind of energy you get from sharing with others is invaluable. But then we're also very big on one-on-one sessions as well, especially for patients that do have more fatigue after they've been in their sessions with, PT and OT, who want to maybe be in their room more. We can bring them things to do bedside. So we have many different interventions that we create here, and we like to believe we're one of the gold standards, or striving to be, in the field of TR in the rehab setting. And we've created just a cornucopia, I call it, of different therapy modalities that we use, from creative arts such as ceramic painting, canvas painting, coloring and drawing. We also have many different games and cognitive activities like card games, board games, puzzles, brain teasers, and different video games. We also focus on movement and physical wellness, such as dance and therapeutic movement to fun music, nature and animal-assisted therapy, as we talked about the garden, but also doing interventions with our visiting therapy dog. We do relaxation, guided meditation, and aromatherapy. We also offer different support groups for the patients during their stay. Wellness skills. We do a cooking and wellness and healthy
you said
food
cooking.
group. Yes.
You said cooking. So one of the things that always stood out with me, so every year we do our Western Day, right?
Oh, yes,
and our
the
chili
Western Day.
cook-off. And I think what really brought it home for me was you worked with the therapist and the patients,
Yes.
and you did a group of
Making chili for the chili cook-off. That was such a fun day. Yes, because the patients were so excited, and we created different menus for different styles of chili. There was like a white bean chicken chili. There was a traditional beef chili. We did a vegetarian, and we were cooking all day in the kitchen, and we were just having a blast, but then also working on those very functional skills, standing, fine motor, and then, of course, the social emotional, which is, we always say, you're more than just one thing. It's important to have that social emotional support, especially while in the hospital. And then after we made the chili, we went to the Western Day, and it was such a fun competition to see whose chili, won, who was the best, what was the most tasted chili of the day. So that was really special.
That is so great. Ted, so beyond the physical side of recovery, right? How does TR address the emotional and mental challenges that come with being in rehab? Things like, motivation. You can talk about depression or the fear of not returning to normal life. These are all part of who we are as human beings. But in your own, in your thoughts, share with us, what do you think about this?
Well, and majority of our patients don't plan to be coming into a rehab hospital. Maybe those who have a joint replacement, it might be part of their expectation. But the vast majority of patients do not have that on their to-do list. So when they come in the hospital, they usually are having to step out of their own lives, out of the middle of whatever they had going on previously. And they're confronted by questions of what life is going to look like after the hospital. How am I going to get through this? How am I going to get back to my role in my family, my role in my community, my professional role? So as part of our program, as Maria mentioned, we like to do a lot of group therapies. That social interaction can really help to keep people motivated and help to reduce the feeling of isolation. We also will host groups we do weekly peer mentor groups, where we have a selection of past rehab patients, usually 3 at a time, come in, and they talk of their experiences, their time in the hospital, their recoveries, getting back to life after rehab. with their families, their community, and their jobs, and whatever else is important with them. That gives patients a chance to just sit in and listen to somebody who's been in the same, pardon me, but same wheelchair they're in, or same place that they've been in before. And so that kind of helps them to start to think, well, there is a future beyond my discharge date. I do see that there's something I can keep striving for.
Right.
I think Maria has also been involved with starting up a very special support group for some of our stroke survivors.
All right. So, Maria, you
And
want to talk about that?
caregivers. Yeah, so it's actually called the Caregiver Support Group, and it is for family members, caregivers, anyone who's supporting a loved one who's going through any diagnosis here, whether it's stroke, spinal cord, any other neurological illness, brain injury. They're more than welcome to come, and we host it the fourth Tuesday of the month at 4 p.m. here at Inova Mount Vernon.
All right. Stacy,
Yeah, so
what you got for them?
I have it. I have it. So because we're in the Metro DC area, we have like just a variety of patients that come to see us. And I think one thing that certainly has stuck with me through the years, Maria, you started a donation for, is it a homeless shelter? Walk us
Yes.
through. What is it that you've taken on, and how the person that runs it used to be a patient here?
Absolutely. So it is our previous patient. He is the pastoral director of the Lamb Center, and it's a drop-in for the unhoused. It's located in Fairfax City, but they serve the surrounding area. And he is that patient. He is now one of our peer mentors, like what Ted was talking about. He comes in and volunteers once a month to speak and share his story with our current patients. And we were like, Dave, you do so much for us. We want to give back to you, because he has always spoken so highly of the Lamb Center, and that was his biggest goal, was to get back there to direct it. So we've organized a small team of therapists, and we go every 3 months and serve there at the Lamb Center and help Dave with whatever he needs. Usually we're doing laundry because there's so much laundry that needs to be done. We're also handing out toiletries to the clients that come through. We've also served drinks and breakfast for them as well. So, and then we'll do a drive every fall here at Mount Vernon to collect items to donate.
That's interesting.
So, I think we are setting the national standard here for therapeutic rest.
Yes, we've also brought information like Be Fast stroke information and information on the Inova Cares for Families centers. So, clients can see that, and they can be more empowered about their health education as well.
So not everybody listening is medical, but everybody's at risk for a stroke. What does Be Fast stand for?
Be Fast is the acronym that you can always think of, so you know the signs and symptoms of a stroke. The B stands for balance. E stands for eyes. Do you have any visual changes? The F stands for face, numbness, droopiness in your face. The A stands for arm, sudden weakness in your arm. The S stands for speech, and the T stands for time, because time is brain.
Brain. Maria, that was great.
Yes. I've only gone over that a few times.
So here, right, you guys are amazing. Very
You
amazing.
are too.
But you know something? When you walk through the doors, okay, when you come to rehab and you're walking through the doors and we see all the wonderful things that you do, I guess probably somebody's thinking, I want to be like Ted. I want to be like Maria. So can you tell us, how can one be a therapeutic recreationist? What is the pathway?
Well, you first find a university that provides recreational therapy or therapeutic recreation coursework. There are several across the country. Once you're enrolled in that program, you're participating in TR-specific coursework as well as coursework including anatomy, physiology, psychology, kinesiology. It's also coursework on development. So it kind of gives you a broad spectrum of education through those classes throughout your program. Usually it's a 2-year program.
Well, it's a bachelor's of science.
Well, it's a bachelor's, so
degree.
you have your 2 years of undergrad, but then the program itself adds up to about 2 years. Through that, you're getting exposed to a few different opportunities, different directions you can go with recreational therapy. Finally, before graduating, you'll be tasked with completing a 14-week internship, choosing a site somewhere in the community that hopefully is a place that is in the part of the field that you're interested in going into. That gives you a lot of real-life professional experience working with patients, clients, stuff that you don't pick up from the textbook. Yeah.
Right.
And then after you complete that and you graduate, you're able to sit for the certification exam, and after passing that, you're deemed a certified therapeutic recreation specialist.
So I guess my next question would be, why? What personally took you down this pathway? We all have a why, right?
That's
all right,
true.
Maria, what's your why?
Oh my goodness. So I can't even count how many years it's been, but my story first started the summer I was going into 10th grade. My mom didn't want me just sitting at home, back in those days, like surfing the AOL Instant Messenger. So she signed me up, and I don't know if this is still a thing. I don't think it is, but she signed me up to be the old school candy striper at the hospital. And I was assigned to a more subacute part of the hospital. So there was a recreational therapist there, and I worked under her for 2 weeks, and I loved it. I absolutely loved it. I talked to all the patients. I did all the activities. And I remember at the very end of my time there, we had like a summer luau for all the patients, and it was so much fun. And I actually didn't want to go back to high school. I was like, I want to stay here and keep working. So that was really, I think, when recreational therapy was put on my heart. And then as I got older, I did more kind of volunteer work and part-time activities assistant at the local skilled nursing facility. So I got exposure. But then when I went to college, I was kind of thinking maybe I want to do social work, maybe I want to do TR, maybe I want to do counseling. I knew I wanted to be in a field that helped others. But I was walking through the student center one day, and the Therapeutic Recreation Department had set up their little table to recruit students, and I just felt I want to go over there and sign up. So I went over there and signed up, and it's been the best thing. And I got my Bachelor's of Science in Therapeutic Recreation in 2006. I took the national certification exam in 2007. And then here I am with you today still.
And so what do we say? The rest is what?
And the rest is history. Yeah.
So Ted, tell us about your story.
Mine started it started 19 years ago. I was involved in a traumatic bicycle accident. I sustained a traumatic brain injury as well as several broken bones in my body. I was in a coma for a while and went through recovery from that. And then once I was stable enough, I was able to go to an acute rehabilitation hospital down in Atlanta, Georgia. And at the time I was 20 years old. As a 20-year-old going through this, my background in school was not something to brag about. I was kind of at a lost time where I wasn't sure what direction I wanted to go in when this happened. So as I was a 20-year-old and going through this experience and starting to understand or starting to see what was happening, what I had been through, what other patients were going through, I think I started to make a connection that I could use my own experience and my own recovery to support others as they go through their own experiences of recovery, and hopefully, just be able to use my experience for a connection that not many people are able to have.
Ladies and gentlemen, we are very, very honored to have Ted and Maria, who are both therapeutic recreationists over here at Innova Mount Vernon Hospital. And personally, anytime when I'm walking through the hallways and I see the engagement you have with patients, it really, really kind of, it heartens my heart that you're reaching out to individuals who are vulnerable. They are very much at their lowest. But what you are doing is that you are bringing them back to where they can do something for themselves. So we want to say that, your role in rehab is just above the board. So probably somebody might not tell you, but you are an integral part of rehab. Same way as you would find somebody, in a wheelchair going in for PT, somebody going in for OT. So let me go check check the voice, okay? Speech for that matter. But then, without you, certain things wouldn't come into play. So when I kind of look at the cycle of things, when I look at that cycle, okay, TR is right there as part of the cycle. Without TR, that cycle is not complete.
We absolutely,
Yeah.
agree with that. Thank
It's
you.
not complete. Stacy, what do you think?
So I think that we are setting the national standard.
I agree.
And I think it has a lot to do with professionals that are not nurses and that are not therapists, but that are therapeutic recreational therapists. Because you know what? You're not going to make me work really hard, at least not that I'm going to realize that you're making me work really hard. You're not going to ask me to take my clothes off. You're not going to ask me to take a bath. You're not going to show me how I should be washing myself or how I should be getting dressed. You offer that break in the day that the patients can look forward to. This is going to be fun. Yeah, it's work, and what you do makes a difference, absolutely, medically and cognitively with the patient. But I think mentally, in their brain, this is what we look forward to. Because we're 24/7, right? You have the same nurses 24 hours a day. You have hospitalists and PM&R doctors and the professional therapist and neuropsychologist. But you offer the break. You're yes, I'm going to go outside and we're going to plant some plants. And I know you're going to be assessing on how well I can pick something up and put it into the dirt, right? Because that's all the stuff that you do. But you make rehab fun for our patients. There's dancing, there's singing. What was the last one? We had Frank Sinatra here, did we?
Oh, surely we did.
That was a very special day.
We need more. We
Yeah.
need more. Who was it that came last year?
We had the Elvis impersonator.
Oh gosh, we had Elvis.
Yeah.
But didn't we have the local stars? The soccer, was it soccer stars?
Oh, yeah.
Yes,
So
the
How
could we
DC
forget that?
United. That
Yeah.
was so exciting. They came to our annual Christmas market.
What is the annual Christmas market?
So we set out items that patients may want to give their families because they're not able to get out and go shopping, that they can come in and select, and we will wrap them together and they can give them to their families for Christmas. We do that every year around maybe the week or a few days before Christmas.
Do you take donations for that?
Yes, absolutely.
And how would any of our listeners, be able to donate?
You can send an email to Ted and myself, and we're happy to receive. We get donations every year. Everything from candles to, those little Christmas houses that you can set out, to books. What else have we gotten?
We've gotten maybe some games, card games, etc., puzzles,
Ornaments.
ornaments. Yeah, we've gotten some kitchen utensils. That's something that sometimes people don't realize, but that could be a useful gift for somebody.
Mugs.
Wow.
Even some things for kids, like if a patient had grandkids they wanted to get gifts
See,
for.
this is what I'm talking about, that we're healing with the heart, because if I'm a grandma and I can't get out to get my grandson or my granddaughter a toy because I'm in rehab,
We
I don't
have the toy
to
shop
worry.
right here.
We have the toy shops right here.
Yes. So that's a really special day. And of course, we make it festive. We have the music going. And I think last year we made hot cocoa.
Yep.
So,
And that's a hard time for anybody to be in the hospital, because in addition to, just pulling you out of your normal day-to-day routine, that time a lot of people are spending time with their family and their loved ones. And so being in the hospital, they're missing out on those meaningful memories that they're able to establish. So having something like this holiday market really helps keep patients connected with the person they are inside, and make sure that they can feel like they are recognized. Even though they're in the hospital, they can still be part of the holiday spirit.
Yes. So for Maria and Ted, right, I know that patients will come in on admissions, they stay a couple of days and sometimes weeks. But the goal is to discharge them to home or wherever they are going. Okay. So let's look at this. Let's talk about discharge, okay, and the role that the therapeutic recreationists play in that. So when a patient is discharged from inpatient rehab, does TR play any role in helping them transition back to their community and everyday activity? So for Ted and Maria, what are your thoughts on this one?
definitely. Absolutely. A few things come to mind. The first thing I wanted to touch on is just the education. We offer many different education classes here. One of them is our Food for Wellness group. So we will talk about how when you go back home, you can approach cooking and eating from a way that could enhance your nutritional intake and hopefully help prevent any, slides in your blood sugar, blood pressure, or cholesterol. So we'll give patients extensive education on like the DASH diet, managing your blood sugar, and when you go to the grocery store, how to make those little choices. Maybe it's just as easy as getting the can of beans that say low sodium, right? You start small. Instead of having white bread, have wheat bread. Instead of adding salt, have, natural herbs and seasonings. So we definitely will do that sort of education, and then we'll make like a healthy salad together so the patients can have that kind of education to empower them when they're back in the community. We also do various leisure education where we talk about activities they can continue with out in the community, such as like adaptive sports, aquatics, fitness. We give lots of referrals to the local ceramics shop. So if anybody's listening, like, hi, because we're sending lots of people your way because a lot of patients enjoy getting into ceramics while they're here and they want to continue with that. We'll also refer them to the local rec centers if they want to do different classes, whether it's yoga or, lectures. I didn't know they even did lectures out in the community at the rec centers, but they do. So we found a lot, and it's really just to make sure the patient is staying active when they go home and they have, just kind of the education to empower them, but also to prevent further injury or illness or disease.
Okay. Ted, how about you?
We also like to take patients out on community outings. That's, as we've talked about, the bridging from the gap from the hospital to back to real life can seem like a big wide canyon for many people. Just the opportunity to get somebody get them out of the hospital, maybe go to a local restaurant, or maybe you could do a light, shopping trip, or just visiting a favorite store, can really help connect everything that patients have been working on and focusing on here in therapy, connect it to how they're going to be able to get back to that life that they look forward to living in the community.
So we have our guest, Maria and Ted, and obviously Miss Stacy Sharp, the Senior Director for Nursing. Stacy, your final thoughts.
I do a lot of the administrative aspect of rehab, and you all see me sometimes in my office and meetings. But I love to tell our story, and both of you make such an impact on the story for Inova Mount Vernon inpatient rehabilitation. I appreciate you.
Thank you.
The patients appreciate you. You are people that make such a big difference for our patients. If you didn't, they wouldn't come back to visit, and often they come back to visit. So, Dr. Mpoma, this has been quite the moving segment, I would say, because it's really taken us to the heart for our patients and truly what matters most.
And thank you again, Maria and Ted. We are really honored to have both of you share your thoughts and everything that is on your heart, especially caring for your patients and looking at it from the lens of a therapeutic recreationist. Thank you all so much.
Thank you for having us.
Thank you very much for having me.